Thank you. Can you all hear me okay? All right, great. Welcome, everyone. My name is Stephanie Scarmo. I'm a proud member of the National Collaborative for Infants and Toddlers, as well as the National Senior Director of Policy Research at Voices for Healthy Kids. We're so pleased that you could join us for today's discussion on the importance of SNAP for children prenatally to 3. For more than 50 years, the Supplemental Nutrition Assistance Program, or SNAP, has been vital in addressing food insecurity in the U.S. SNAP helps households with the fewest resources to purchase food and reaches more than 41 million people, including almost 5 million children under the age of 4. On today's webinar, we'll hear why SNAP is such an important prenatal-to-3 program and learn lessons from a state campaign that expanded access to SNAP. But first, a couple of housekeeping notes. Today's call is being recorded, and we will share the recording slides, tools, and resources within a week. Please watch your email inbox for those items. We do ask that you please keep yourself on mute when you're not speaking to help ensure good sound quality throughout the webinar. If you need assistance during the call, please message Andrea Guarnero. She will be happy to help you. We will have a Q&A session at the end of the call. If you have questions, you can either enter them directly into the chat or feel free to raise your hand. We will call on you and you can come off mute to ask those questions. At the end of the session, we will share a brief survey. We ask you all to take 2 minutes to complete it. We really do take your feedback seriously, and it will help make these types of events better in the future. And now I'd like to turn it over to our first presenters. I'm pleased to have with us Dr. Abby Lane and Victoria Hunter-Gibney. Dr. Abby Lane is the Policy Director at the Prenatal-to-Three Policy Impact Center at Vanderbilt University. In her role, she leads a team of researchers and policy analysts in conducting comprehensive reviews of the evidence on prenatal-to-3 policies and tracking the development, adoption, and implementation of these policies, including their potential to promote equity. Abby holds a PhD in public policy from the University of Texas at Austin. Her expertise is in early care and education with a broader background in social, family, and early childhood policy. Victoria Gibney is a Senior Equity Research Associate at Vanderbilt's Prenatal-to-Three Policy Impact Center, where her work focuses on economic and family supports. She's also a doctoral student at American University studying anti-poverty policy. Before relocating to Washington, D.C., Victoria earned her Master of Public Health at the University of Florida and worked for over 5 years implementing SNAP Ed policy in Florida, or SNAP education in Florida, rather. Welcome, Abby and Victoria. I will now turn it over to you.
Thank you, Stephanie. Can everyone hear me? Okay.
Yep.
Yes, awesome. Okay. Well, thank you for having us here today. We're really excited to join you all to talk about the importance of SNAP during the prenatal-to-3 period. To start us off today, I want to briefly introduce our organization. Victoria, do you mind going to the next slide? Sorry. Is it working? There we go. The Prenatal-to-Three Policy Impact Center is a nonpartisan research organization based out of Vanderbilt University's Peabody College. We have a team of researchers and nonpartisan policy experts who work directly with policy leaders in states. I'm getting a little bit of a feedback. If everybody can just check they're muted. Thank you so much. I appreciate it. The goal of our work is really to empower states with rigorous evidence to accelerate the equitable implementation of evidence-based policies that help all children thrive from the start. Before we get to SNAP, I want to step back to why it is that we focus on the prenatal to age 3 period of development. Although we're always happy to talk about this more, I'm going to keep it really simple today. The prenatal to age 3 period is the most sensitive and rapid period of development, and it sets the stage for subsequent health and well-being. Many of you likely already know this, but grounding our work in the well-established science of the developing child is really important. We know that babies are born with potential, and children born healthy and cared for in nurturing environments are set on a trajectory toward lifelong success. Research is also clear that there are things that we can do to promote the conditions our children, families, and caregivers need to thrive. Next, there you go. Although important policy work happens at all levels of government, there are state policy choices that can be made to support parents and promote healthy development of children. And state policy choices shape opportunities for families. When designing and implementing policies, states can and do make different policy choices, which lead to policy variation and a patchwork of supports for families that depend heavily on where they live. We've operationalized the science of the developing child into 8 prenatal-to-3 policy goals that include ensuring that children have access to the resources they are eligible for, that families can balance work and caring for their children, that families have sufficient and stable resources, including food security, that our babies are born healthy and to healthy parents, taking into account both physical and emotional and mental health, that parents have the skills and knowledge of their children's development to allow them to engage in nurturing interactions with their children, and then when children are not with their parents, they're also in nurturing environments. And importantly, you want to make sure that we're identifying any developmental delays and providing targeted services and supports to make sure that children are on track for optimal development. So to foster a robust, comprehensive prenatal-to-3 system of care, states need to realize all 8 of these goals. And to identify how states can improve outcomes within each of these goals, our team of researchers have analyzed thousands of research studies to identify and synthesize research on the most effective state-level policies. We've compiled this information in our annual Prenatal-to-Three State Policy Roadmap. The roadmap identifies 12 evidence-based policy solutions proven to impact prenatal-to-3 policy goals. It provides a policy landscape across all 50 states and DC, including both which states have adopted and implemented certain policies and variation in how states are implementing policies. It provides a data dashboard of 20 outcome measures so you can track progress across the prenatal-to-3 policy goals, as well as provides national and state demographic data to better understand the context in your state. Additionally, we also have a policy impact calculator that demonstrates the impact of policy choices made in each state on a family's resources. I want to briefly share an example of the type of information you can find in our policy impact calculator. So in this simulation, imagine that Lena is a single mother. She has a toddler and she just gave birth to a new baby. She works full-time all year and earns the state minimum wage. We assume Lena files her taxes and receives all benefits she's eligible for. Because new parents need the opportunity to heal and bond with a new child, Lena takes 12 weeks off of work following her baby's birth, and she sends her children to center-based care, which charges a rate equivalent to the 75th percentile of the market rate in the state. I know this is a lot of detail, and we know some of these are very big assumptions, but what I want to do is show how state policy choices matter for Lena. So on our website, you can see how state policy choices in your state impact the level of resources that Lena would have to care for herself and her family. And you can compare your state to every other state as well. In this graphic, you can see our simulation for Tennessee, which is our home state for Vanderbilt. And there are a lot of stories that this colorful little bar chart can actually tell, like how Lena doesn't have access to paid family leave in the state, or how she doesn't have access to state tax credits that could benefit her because they aren't offered in Tennessee. And one thing that you can see here is that Lena does benefit a lot from federal programs, including SNAP. In Tennessee, Lena's SNAP benefits are nearly $10,000 a year, which make up a substantial portion of the resources that she has available to her after accounting for her wages, her childcare costs, and the various benefits available to her. This all means that SNAP is a really important policy for Lena in this early period of her children's lives. So with that, I'm actually going to hand off to my colleague, Victoria, who's going to continue to dive into SNAP.
Thank you, Abby. I'll start with a little more background on SNAP, and Stephanie covered it nicely at the start of the call as well. As she said, SNAP stands for Supplemental Nutrition Assistance Program. It's the program formerly known as food stamps, but we prefer SNAP to reduce that stigma that was associated with the older name. And it provides nutrition benefits to low-income individuals and families to be used at stores and farmers markets to purchase food. It's the largest federal food assistance program in the United States. It reaches over 7 million households with children every year. And as we saw with Lena, SNAP makes a big difference in the resources available to a family with low income. As a state policy center, we're interested in SNAP because while the benefits are federally funded and benefit amounts are standardized at the national level, states have important discretion over how SNAP is administered. We're also interested in SNAP because, as the title of this webinar suggests, SNAP is associated with a number of critical outcomes in the prenatal-to-3 period. Among households that receive SNAP, we observe improved birth outcomes, reduced childhood food insecurity, and increased healthcare use among children. There's also evidence that exposure to SNAP during early childhood is associated with a number of longer-term benefits, including gains in human capital, economic self-sufficiency, neighborhood quality in adulthood, increased life expectancy, as well as a decreased likelihood of incarceration. let me go back. Unfortunately, not every SNAP eligible family participates in the program. In the United States, 17% of eligible families with children do not receive SNAP, and that number jumps up to 27% for Hispanic children and children with a racial ethnic identity other than white, Hispanic, or Black. That is more than 1 out of every 4 children in those groups who are eligible but not receiving those benefits. Non-participation rates also differ widely by state, and this is a great demonstration of what Abby was saying earlier about state policy choices mattering for families. At one end of the spectrum is Oklahoma, which has a non-participation rate of 5.5%, meaning that state has high participation among eligible families. We can compare this to New Jersey, where nearly a third of SNAP eligible families are not participating. So why do we see this variation when SNAP is a federal program? As I mentioned earlier, states have significant discretion over how SNAP is administered. Like so many public programs, the experience of receiving SNAP is shaped by administrative burden. Administrative burden refers to the accumulation of costs that folks face when they seek public services and can take the form of learning costs, which is the challenge of knowing if you're even eligible, where to apply, etc. Compliance costs, which for SNAP can look like gathering the documentation you need to verify your eligibility, and then regularly recertifying with the state agency. And psychological costs, which can include facing stigma and suspicion when you're trying to meet your family's basic needs. You can imagine that together, these costs present significant barriers for eligible families seeking food assistance. On the other hand, when we reduce administrative burden for eligible families, we see increases in SNAP participation, which then experiences food hardship and leads to those other benefits that I shared earlier. Specifically, our rigorous review of the existing evidence shows that lengthening recertification intervals and reducing transaction costs and stigma increase SNAP participation. Abby's going to share and has shared a link in the chat to our evidence review on administrative burden in SNAP, which goes into a lot more detail on these findings, and I hope it'll be a helpful resource. As part of the Prenatal-to-Three state policy roadmap that Abby mentioned, we track state policy actions on 3 key levers related to administrative burden in SNAP. That's 12-month certification periods, simplified reporting between recertifications, and access to online case management services. As of October 2023, 10 states have implemented all 3 of these levers to reduce administrative burden in SNAP for families with children, which is to say that we have a lot of room to continue improving and reducing administrative burden for families that are eligible for SNAP. So to wrap things up on our end, state policy choices matter. States have the discretion to reduce barriers to accessing SNAP, which is a critical form of food assistance for families, and help eligible families to support the healthy development of their kids. Thank you so much to Voices and NCIT for inviting us. You can learn more about the Prenatal-to-Three Policy Impact Center and find all the resources we mentioned today on our website, pn3policy.org, and follow us on X and LinkedIn to stay up to date with our work. Thank you.
Thank you so much, Abby and Victoria. It is so helpful to have that foundation for how SNAP is an important program for families and how state policies can greatly impact a family's ability to utilize the program. I am Katie Bishop Kendrick. I am one of the National Senior Advocacy Consultants with Voices for Healthy Kids, and I have the pleasure of working with our campaigns that are focused on nutrition security policies, including SNAP and school foods policies, which includes being able to work with our next speaker. So next you're going to be hearing from Sarah Ismail, a soon-to-be former Voices for Healthy Kids grantee that worked on a successful campaign to improve access to the SNAP program in Michigan. Sarah is a public policy associate with the National Network for Arab American Communities, which is an institute of access, the Arab Community Center for Economic and Social Services. Sarah's work is centered on Middle Eastern and North African inclusion at the state and local level, and addressing data inequities and racial disparities for MENA communities. So with that, I'm going to turn it over to Sarah and just remind folks to put any questions that you have in the chat box, and we'll address those at the end of the webinar. So you can take it away, Sarah.
Thank you so much, Katie, and thank you to Abby for doing such a phenomenal job explaining SNAP and Prenatal-to-Three. So like Katie said, my name is Sarah Ismail, I'm a policy associate with Access. And I'm just going to jump in and kind of talk about how do we identify policy issue areas that affect us here in Michigan. And I'm going to give a quick overview of who and what Access is. So Access is the Arab Community Center for Economic and Social Services. We are the largest Arab American community-based organization in the country. We're a national institution, and we have over 120 programs in over 10 locations, and we predominantly focus on Southeast Michigan. So we're based in Dearborn, and that's just outside of Detroit. For those of you who are familiar with the geographic area, we serve 70,000 clients annually. And these are clients who come in for a variety of services. We provide services for behavioral mental health, workforce development, youth and education, just a very, very wide array. And so under those departments, we have over 120 programs where we're able to serve not only Arab American communities, but the diverse clientele that comes through our doors. So we serve 60% of our clients are Arab American, and then the rest are different data demographics that come through. And we serve immigrants, refugees, asylum seekers, first-gen Arab Americans, second-gen Arab Americans. It's just a myriad number of clientele. And so we officially became recognized as our own category by the federal government on March 28th of this year. This was something that we've been working on for our organization specifically has been working on for close to 30 years. And so we were not recognized as our own race or ethnic identity. So now we're officially recognized as an East North African community. And it took a very, very long time to get this category. But by getting this category, we now are able to quantify the needs of our community. We're able to understand better program services, how to meet unmet needs, having specialized programming. So we're very excited that this finally happens. It's just a starting point of getting that data and being able to utilize it to better our community. So the first approach that we use to identifying policy is caseworkers. So I tell people all the time that I feel very, very lucky that I get to work with an organization that is on the ground, that's in the community and sees what's happening. And so what essentially happens is caseworkers will be the first line of defense when it comes to clients. They're the first people that they meet when they come through those doors. And usually when you start off any point of you entering Access, you always end up with wraparound services. So we work in terms of the entire family, starting from as young as the child all the way up to the grandparent. So we might have a child that comes in our youth and education department for after school programming. They'll have a social worker or a caseworker. And the next thing you know, we figure out what the family needs. Are they food insecure? Do they have housing? Do they have a sick parent? Do they have a grandparent that needs support? So we're able to work with the entire family to give them that. And every single client has a caseworker, and this caseworker is there to support them throughout their time at Access. And it really gives them a sense of trust and a sense of being able to identify with someone that is descriptive of them. So that's one of the really great aspects that we have. And we also work with vulnerable communities. So we have programming for LGBT community, for domestic violence, survivors of torture. Our community is heavily surveilled, so that's another aspect that we take into account. We also have our WIC program that supports, families just trying to get resources. And then this kind of leads to how we identify these policy issues. So the way that it kind of happens is the caseworkers identify the policy issue, and then I get in touch with the caseworker, or they get in touch with me telling me, hey, we're seeing a pattern, we're seeing a trend of families not being able to support themselves. In the case of SNAP, it was very eye-opening to see how it affected not only our community, but all of Michigan. And so I look to them I look for them to guidance in terms of the trends and patterns that we use to identify what policy issue areas that we take on as an organization. And they eliminate a lot of the barriers. People are comfortable talking to their caseworker. They're not comfortable talking to people that they don't feel like they have built that rapport with, that trust with. So they eliminate the language barrier. So if we have clients that are Arabic speaking, we also have a lot of clients that are non-Arabs that might be Spanish speaking or speak Pashto or Dari or something else of that nature. So usually you get a caseworker that also speaks your same language. And if not, we always figure out a way. They also eliminate the taboos surrounded by, culture in terms of getting services and asking for help. So they really make my job so much more easier. And so that's how we identified SNAP. I had a caseworker come to me and she's like, I don't know if you know this, but we're actually seeing so many clients who are getting their SNAP benefits cut, in particular when it came to single head of households and then also elderly couples. And so this was a major barrier. And they explained to me that losing their benefits was sometimes over $1, if not $10. And so that's very devastating when you already have limited income, when you are trying to adjust to inflation. So all of these things were actively circumventing our clients from being able to lift themselves out of poverty. And we know SNAP is one of those tools that can be used to do that. And so that's when I got to work. I started figuring out how we can work on this issue to the greatest extent possible. And this wasn't an issue that was only affecting Arab Americans, but it was affecting so many different communities throughout the state of Michigan. And the reason why I have asset limit is in flux is because Michigan is a swing state. We're purple. We're a very purple state. Every time governorship would change, so would the asset limit. And so that would cause people to lose their benefits, gain benefits, and it was very, very confusing. So under Governor Snyder's administration, the asset limit was at 5,000. And the next, it changed again under Governor Whitmer and it went up to 15,000. So it leads to a lot of confusion in terms of the policy. And on top of that, at the same time, sometimes state agencies do not work fast enough when regulations and policies are being changed. So we were seeing that with MDHHS, Michigan Department of Health and Human Services, as these changes were happening, they couldn't keep up. So that led to a lot of confusion in terms of caseworkers on their end, like the specialists being able to figure out, okay, do you meet the asset limit or not? People fell off in terms of benefits, they had to reapply. So it led to so many different issues. And so that's the reason why we embarked on our SNAP campaign. One of the things that we did was we identified partners from across the state who worked with so many different communities. For example, we identified one organization that works with Black immigrants. And so we knew that it was also affecting their communities. We identified organizations in Flint, and we know Flint was hit very, very hard in terms of the water crisis that happened there. And so we were able to bring these partners along from different parts of the state to help us advance this campaign. And so the way we did it was we had a massive social media campaign. We had a toolkit. And now if you don't have a hashtag, did it really happen? So we went with SNAP and food security. And so we created this entire toolkit that was very comprehensive in terms of explaining who our community was, explaining how it affected all these other communities that lived in the state of Michigan. It went through and it provided language that they could use, like tweets that they could share, social media posts. We had a one-pager that was linked to our phone to action. So we actually were able to, really galvanize support by getting people involved. And all of our content was in English and in Arabic. And to some degree, we also had language in Spanish as well to be inclusive of the different communities that surrounded us. And so another way that we did that was, just to go back real quick. So the phone to action was actually used to galvanize support to get legislators to push the bill forward. And so there was a bill that we were able to amend to get SNAP in place. And so it took a lot of support and it did pass, which we're very excited about. But it was not an immediate effect. So this campaign went really, really quickly. But because Republicans took issue with the bill, we weren't able to give it immediate effect. And it actually took them adjourning. So it took close to 10 months for it to go into effect. But another aspect of our social media campaign was client stories. I cannot emphasize enough how important it is to humanize the issue. And that's what we did. We had actual clients that gave us stories of how SNAP was the one tool that was helping them stay afloat, that was helping them, take money that they would normally use for groceries and put that towards rent or their car note or insurance. So it was something that, we felt very strongly about, and we were very, very happy when it happens. And so this is my contact information. And I know we will have a Q&A to discuss further. Thank you.
Thank you so much for that. Thank you, Abby, Victoria, and Sarah. You guys have given quite a bit of information on SNAP and how its importance for the Prenatal-to-Three family unit, and insight on the campaigns that can help people make SNAP more accessible. And I think something that Sarah said is really important, that SNAP is one of those tools and resources that can be used to help lift families out of poverty. And so being aware of it as a tool that can be life altering, right? Sometimes folks just need to step up in an opportunity. And so it's important to note that. So we're going to shift into question and answer right now. You've all received some great information. So what I'm going to do is ask you all to put questions in the chat box, or if you want to, feel free to use the raise your hand function. Sometimes I understand a question might be easier to ask verbally than to type it out. So feel free to either post your question in the chat or use the raise your hand tool, and we'll recognize you for this question and answer portion. One of the places that I like to start, just as a really quick recap for Abby and Victoria, in the Prenatal-to-Three Policy Impact Center's roadmap, you identified 3 key policy levers that states can implement to increase participation in SNAP for eligible families. And so as you track states' progress, what new potential levers are you seeing that can also be utilized?
Absolutely. And I'll say that the levers that we track and publish state actions on right now are focused on those that have the strongest evidence base behind them, because we are a research center first and foremost, but we are constantly keeping an eye on the evidence base as it expands, and state policy changes are happening faster than we have evidence to evaluate them. So we are also considering just experiments that states are trying, and also things that we've seen that happen in COVID, for instance, where interview requirements were waived, and there's new evidence that was a big help to folks to not have to go to these interviews. And I think that's the biggest trend that we're observing overall, is how can we make the interview requirement in SNAP less of a burden on families. So things that we're seeing states try are on-demand interviews. So instead of right now, when you apply for SNAP, within 30 days, you need to be interviewed by a SNAP caseworker. The sort of standard practice is that interview gets scheduled not by the applicant, and they have to be available to do that interview. So we've seen, over a 20-30 year span, that we've evolved from those having to be in person to now they can be over the phone. And the on-demand interview is anytime during that 30 days, the applicant can call at their convenience and have that interview. We're also seeing something called case banking, which is where instead of having an assigned caseworker and you have to sort of negotiate their availability and their time to do their interview, you just get connected to the next available caseworker. So again, it's less of a burden on the applicant's time, and it's more focused on their convenience and their needs time-wise, rather than the state agencies. So really centering how we can make this work, especially for families that are sometimes working multiple jobs, navigating childcare challenges, transportation challenges. This should be easy to do. It is one of our few true entitlement programs where if you are eligible, you should receive benefits, but these challenges are what keep folks from participating, even though they meet all the eligibility criteria. So the changes in the interviews are the real thing we're seeing beyond those lengthier recertification periods, simplified reporting, and the online services. We do have a couple states that don't yet have online applications for SNAP. So we'd love to see it get to 50+ DC. Everyone has the ability to apply online. And also that those applications are mobile friendly, because we know that a lot of low-income folks are accessing web-based services primarily through a smartphone rather than like a desktop or a laptop computer.
Thank you so much. Abby, did you want to add anything to that? Or? Thank you. And I see a few chat questions in the chat we're going to come to in just a second here. Sarah, one of the things that you talked about was the toolkit that you created to support advocates working to improve access to SNAP. And we know that oftentimes one of the biggest barriers to seeing change is that we have really great plans that there's a disconnect oftentimes with the intended audience. And so can you talk to us a little bit about how you guys work through that toolkit and what that looked like to make it most effective to those families to utilize?
Absolutely. I can actually show you guys the toolkit real quick. Um, Sorry, I'm having technical difficulties. It's not pulling up. Okay, so this is actually our toolkit. It is kind of long, but don't, it's a little intimidating. But what we did with our toolkit is we made sure, so not many communities know what MENA is. We kind of explained who we are, what our community looks like, because it's extremely diverse, our community. We also provided a bullet point summary of language that we were using, and kind of how we were centering our campaign, which is extremely important. Because with the campaign this large, because it was a statewide campaign, you can start to lose the focus and what it's actually about. So we kept that in mind. And like I said before, we made sure, because the majority of our clients, so Arab Americans in the state of Michigan are numbered, and we don't have an accurate count just because we just got status recognizing us. So we don't have, population numbers, but an estimate would be over 300,000. And so we took into account our community by having everything in Arabic. We had outreach emails that we were able to give our partners that could share out, and talk to people about the SNAP campaign. And so Aviza, the Black org that we were using, do a phenomenal job with WhatsApp. They are able to get to so many people because that's their niche. So knowing that that was their niche, we made sure that there was an aspect of the toolkit that took them into account. So their communities speak Wolof, French, and some of those languages you can't actually write. So voice notes and videos were how they were able to, disperse all this information, disseminate it. So we made sure that we had messaging around that for them to use. So it was an aspect of the toolkit was playing to the strengths of our partners. So that way we could maximize the amount of people that we were able to get. And just to show you real quick, these were the social media posts that we made. So these are the captions on the right side. We kept it very simple. We made sure that it was digestible language. Not everything has to be complicated. It doesn't really have to be, we don't have to be a wordsmith to get the message across. So we made sure to keep that in mind. And so that's kind of, just an overview of how we were able to really get the campaign going. And the last thing is we created these one-pagers, and I love a good QR code. Because the QR code actually took you to the phone to action. So not only were you learning about SNAP in that moment, but then you can go to the phone to action and actually send a letter advocating for your elected officials to create that change at the state level in terms of passing that bill, so we could remove the asset limit.
Thank you so much for that. That's a really good overview. And you're right, sometimes keeping it simple is critical to reaching our intended audience. I see another question in the chat, and I see some of you guys answering those questions. But from Michelle Atkins, it's asking if we can talk a little bit about how SNAP and WIC align or don't align. Is there someone want to tackle that one?
I'll speak to the extent that I'm able to. I think maybe the question could be viewed from what are like acceptable purchases with WIC benefits versus SNAP benefits. So some folks, even if you've never benefited from WIC yourself, you may have seen in the grocery store that certain items in the store will say like WIC acceptable. So WIC is a targeted nutrition program, meaning that they limit what benefits can be spent on to items that the program has deemed supportive of a healthy diet for mom and baby, whereas SNAP has fewer limitations on what can be purchased with those benefits, other than obviously you can't use it for alcohol, tobacco. You also can't use SNAP benefits for ready-made food, nor WIC, but that is a a question that's come up recently is, especially for folks who have inconsistent access to cooking at home. As I think Stephanie mentioned, I'm from Florida, and we have a very large population, especially in Central Florida, who live consistently in hotel rooms. And so we were navigating, okay, how do we support folks to cook with a coffee maker or with a microwave? And so there's that question of, you know, if anyone's a Costco member, that $5 rotisserie chicken is a great deal. Costco's losing money on that chicken. That is not something you can buy with SNAP benefits, even though it's a really high value product, because of these restrictions on ready to eat foods being purchased with SNAP. So those are just, I think that is like the thing that comes to mind for me, is how SNAP and WIC are most fundamentally different, besides who's eligible for it, is how those benefits can be spent. Hopefully that helps.
So much.
Question.
Thank you so much for that, Victoria. And I'm going to come to Danielle in just a second. But before that, there's a question in the chat that Sarah has answered, but I think it's important that people hear the response and understand it. And the question is, does immigration status make a difference to these benefits? Sarah, you've answered, so if you can say that, so some folks who may not see the chat can hear.
Absolutely. So that was a really great question, Amy. So in Michigan, we've actually also advocated as an organization to remove the barrier for children under the age of 7 and the pregnant women for them to access these benefits. So I'm not sure how it differs in other states, but technically, if you're a non-US citizen, you can still get it. If you're a green card holder, if you're a designated refugee and asylee, those, it depends on the designation that you have for you to access SNAP benefits. So it's a bit of it's one of those things that are kind of fluid. It just kind of depends on different factors. But for the most part, that's usually what the requirement is for status.
Thank you so much. And I saw a hand from Danielle, but it went down. So I wanted to see if she still had that question, or if there's anyone else out there that has a question for our panelists. Anyone? I'm scrolling through the chat now. Sheena Moses, you have a question?
I'm sorry, could you not hear me, Joshua?
Oh, we couldn't hear you, Danielle.
Okay, sorry about that.
We'll go to Danielle, then Sheena, you'll be on deck for your question.
So I had a question. A couple of times we've seen bills pop up in Indiana where lawmakers wanted to really limit the items that people could purchase through SNAP, like WIC. Are we seeing that in other states? Because it kept popping up. Luckily, we had a great program organization in Indiana. We've been able to fight that back, but you know, we have more lawmakers that are wanting to punish people more so than help them. And so I'm wondering, are other people seeing that in their states too, where they really want to limit the items that can be purchased through SNAP? Anyone? No?
I haven't really seen that. But then again, we have the double up food bucks in our state, where they've actually expanded what you can get in terms of, if you go to a farmer's market, you will actually get money back onto your EBT card if you purchase fresh fruits and vegetables. Sorry. So I don't know in terms of limitations. I haven't seen that here in terms of making it much more restrictive.
Thank you for that. Hopefully that was helpful, Danielle. Sheena, you are muted if you're talking.
Oh, I'm sorry. Okay, so two things. The first thing, I wanted to offer some insight on the question about limitations on SNAP. We did participate, Florida Impact, 2 years ago in a project with a national funder who wanted us to do community engagement with SNAP participants with the sole purpose of limiting SNAP to not being able to purchase sugary beverages. So soda or sugary beverages, there was an aim to kind of remove that from the SNAP list. I have heard that some bills, not in Florida, but some bills have gone forward to push that, but it hasn't gone anywhere, so that's beneficial. But I also wanted to speak to the alignment between SNAP and WIC. For us, when we talk to parents and families who have both benefits, we encourage them to leverage the WIC for financial reasons. We encourage them to leverage the WIC benefits first. So utilize and get everything you need to get out of WIC first, and then tap into the SNAP. Because in Florida, the amount that people get in SNAP is so limited that if you attempt to just use the SNAP first, you'll exhaust all the funds that are given. So we encourage families to utilize WIC if they have it. Get your milk, your cheese, your cereal, your beans, your produce, everything you can get from WIC, get that first, and then tap into your SNAP benefits to get other things.
Thank you so much for that, Sheena. What organization are you with?
Florida Impact.
Thank you. I do believe I saw another hand. Danubia. Hope I'm not butchering that name.
Not at all, not at all. You got it correctly. Danubia Camargo Silva. I am the Nurturing Strong Beginnings Program Officer at the Boston Foundation. And my question is more around philanthropy. Oftentimes we think of philanthropy as just providing grants and money, but I would say 15% of the power within philanthropy is grant making. And we can do so much more. What role can philanthropy play, in your opinions, around being an ally? Because a lot of the programs that we have, food is a basic need. It's part of the social safety net for a lot of families. And sometimes the work that needs to be done is like on top of that. So for example, if a family needs to read a book for their child, for early literacy or whatever it may be, if they don't have food, if they don't have housing, it makes it impossible to do that extra a type of a support or whatever it is that you need to do for your family, that families decide. So the work that around SNAP and all of that and is really important. So what else can philanthropy do, or to just support the work that is so necessary that you're all doing?
So I will say, so philanthropy is very niched, especially here in the state of Michigan, from what I've seen. But the one thing that philanthropy does really, really well is they do a great job. I know you said that, you know, in terms of support, like what else they can do, but that's a really great thing that they do in terms of sussing out organizations that they know are doing the work and being able to support in terms of funding, getting extra staffing, you know, helping in terms of that last push when it comes to legislators. So I think those are the things that philanthropy does really, really well. They tend to be, most of the ones that we've worked with in the state of Michigan tend to be smaller, and they tend to have, they're more niched in the work and have better infrastructure in terms of navigating certain issues, because they only navigate a couple of issues at a time. If that makes sense. So they're better at that in terms of navigating.
Thank you for that. I also see that our executive director, Lori Forcina, posted in the chat that philanthropy can do a better job at funding more policy advocacy led by community-based organizations. It's important to include community-based organizations in that process. I think that's important to note and to keep in mind.
I was going to ask, I think, in addition to Sarah's comments, that organizations like hers and others who are really on the ground and working with communities are the ones that really know that best. And I imagine, to the extent possible, flexibility with funding is certainly helpful for small organizations where sometimes you need funding for the not very exciting things, but that are really important to allow your staff to help serve different clients. So just want to echo what Sarah said and think that those organizations are the ones that are deeply plugged into the communities and what they need most.
Can I answer Ashley's question? So she was asking about a pilot that would reduce backlogs. So one of the things that our organization actually did was, so we were seeing backlogs, and I know that Victoria and Abby touched on how now it's more of a system where whatever caseworker you get. And so that was one of the things that we were advocating for, because we would see clients that would complain about the caseworker that they had. They were too rigid. They weren't very understanding. So now, because it's a round robin of when you call or you reach out to MDHS in our state, whatever caseworker you get would be working you in that moment. And you wouldn't have one specific caseworker. But in terms of the reduction in backlogs, another thing that we were doing before the pandemic, we actually had 2 caseworkers from MDHS embedded within our organization. So they had offices inside of Access. They were bilingual, so they spoke Arabic, and they were able to help clients right then and there in that moment. So, and it was extremely effective, and it was a pilot that they wanted to try out with us, and they thought did really, really well. And they're actually going to bring it back hopefully after. I mean, so in the state of Michigan, they haven't gone back fully. They're actually still remote. So we're hoping that once they do that, they'll actually come back. And it made a huge difference in terms of our clientele, because they were able to talk to someone face to face. And it helps reduce a lot of the barriers that they usually have. So I will say there are certain pilots that you can, advocate for within your community or your organization.
And Sarah, this is Ashley. I just had a quick question to follow up on that. Were they permitted then to certify, or they were just helping navigate to fill out the application?
I want to say it was both. I want to say it was both. So they were doing all of it.
Thank you. This is really good. And I see some great resources and information being posted in the chat. So please take a look at that. Lots of questions getting answered and information being shared about what's happening in other states, things that can be used as a resource for you in your state. It's important. As we move towards closing out, I want to see if there's any final questions for our panelists. Any final questions? Feel free to use the raise your hand tool. Or post in the chat. All right. Well, again, thank you, Abby, Victoria, and Sarah. We appreciate you taking the time to talk with us. For folks who are working on advocacy campaigns, Voices for Healthy Kids and the National Collaborative for Infants and Toddlers is here to support you in your advocacy campaign through a variety of technical assistance, and we can help you to plan and execute that as well. Using our Power Prism tool or resource, we're going to be posting a survey in the chat to get your feedback, as well as to gather information on what is most needed. And there it is. The survey is probably popping up in front of you now. So please take a moment to complete that survey. Thank you all so much for joining us. Thank you to our panelists again. We truly appreciate it and the great resources that you shared. And thank you to those who tuned in today and have also been sharing resources within the chat. We are happy that we're building a community that can share resources and support each other. So this is great. And lastly, happy National Baby Day. Today is National Baby Day. And so hopefully you get the opportunity to visit the ncit.org and take a look at our toolkit and the resources that you can share on social to promote National Baby Day. Thank you, everyone.